now going to really turn it over to our panel so you can hear from them. They definitely are the best ambassadors for the work of the center. And you're going to hear from 4 folks today. So the first is going to be Andrea Toomey, who's one of our research directors that's focused on our global health portfolio, and also working on a lot of our health and equity work, or health equity work. And she's actually been in the center since it started at Duke, and even before then, when a core group of the Duke-Margolis Center actually started at Brookings before we launched here in 2016. So she's been with us for the whole time, and really represents a great intersection of policy, community health, global health work, and working across all the different schools and communities that we impact. And so we'll hear from her. Next, I think, is going to be Dave Anderson, who is one of our research associates based in Andrea is based up in our Washington, D.C. office. David Anderson is here in our Durham office, and he's a research associate who works across a range of different projects within the center. His background is in the insurance industry and has a lot of incredible amount of knowledge and information and passion related to health insurance and policy. And as I think we'll talk a little bit about kind of some of the path that he has taken as well, and the types of work that he works on. And then next, we're going to have Dev Sangphai, who's one of our faculty members. He is a core faculty member within the center and also a member of our faculty executive committee. So if you can go to the next slide, Sarah. And he is vice president for our population health management in the population health management office here at Duke. He's a professor or associate professor within family medicine, pediatrics, and psychiatry, and also has an MBA from Fuqua. And really kind of spans both the clinical side as well as the business and innovation side of things. And then our final speaker is going to be Mira Gill, who's one of our newest members of the center. So she joined us this year and is a research assistant within Margelis, up in our DC office, and is working on our biomedical innovation and real world evidence portfolio. And also will bring a perspective of someone that's early in their career and also hoping to eventually become a physician and kind of integrate that with health policy. And so talk a little bit about that path and where she is and kind of working with the center. So I'm really going to turn it over now just to those 4 members to hear a little bit from them. And then we'll finish off with members of our education team telling a little bit more about how students can get involved with the center and talk about next steps. But I'm always happy to meet with students, talk with students, share any kind of information about the center or next steps. And so, after the time today, I'm happy to answer any questions or connect as useful. So turn it over to you, Andrea.
Great. Hi, everyone. So Jillian, thanks for the introduction. So my name is Andrea Toomey. I'm a research director in global health. What I wanted to talk to you about today, 2 things. One, in terms of career path, the main theme that I'm going to touch on is about choices and taking different opportunities as they come. And then I'll highlight a couple of our initiatives at the center that I've led or have been involved with. So in terms of career path, my first choice was actually between medicine and community health. I, like many of you probably, was on the pre-med track in undergrad. And then I realized, actually, I took a class in community health and I realized that health systems was really where I was most interested in. So I actually double majored in community health and international relations. Following that, my next career choice was kind of unexpected. So I graduated in 2008 when that was one of many crashes. So what I actually did, I took a leap of faith and moved to Argentina. I had a job offer with PricewaterhouseCoopers there to do work with the Global Fund on monitoring and evaluation. I didn't know anyone in Argentina. I didn't have any family members, but I went, I had the job. And I really enjoyed it. I really loved the work, both at PwC and working with the Global Fund. I was doing work in Argentina and in Belize. And so I was able actually to gain a lot of experience that I think I otherwise would not have been able to gain in the US by working abroad. My following choice, though, was that being in Argentina during that period of time for about 2 years, there was a lot of anti-immigrant sentiment. So I actually decided to move, even though I really enjoyed the work itself. I did not want to live in a country where every day there was anti-immigrant sentiment, especially towards my other nationality. I'm Peruvian American, so that was very difficult. So I made the choice to move to Brazil for about a 10-month period. I already had my first master's in London. I already had that set up. So I went to the University of Sao Paulo to do just some research in one of the faculty or in one of the schools there that I got connected with through the Global Fund. Then I went to London to do a master's in health financing, policy and planning, which I'm happy to talk to anyone about. It's a really fabulous program between the London School of Economics and the London School of Hygiene and Tropical Medicine. I came back to DC, which is where I'm originally from. And then my next choice was actually, again, I was kind of waiting on two offers, one of the big four consulting firms, and then the Brookings offer came in. And so at that point, I made a decision to go the think tank route, which I went about 8.5 years ago is when I first started working at Brookings. And then, like Jillian mentioned, I was part of the team that came from Brookings to Duke to launch the Margelis Center. So while I was at Brookings, I was able to start some work in global health. But coming to Duke was really wonderful because of the Duke Global Health Institute, which I see many of you actually here are already involved with. And so that through the last 5 years, I was really given the opportunity to grow out the global health portfolio at Duke and at Margelis, which I'm happy to now transition to just talk about some of the highlights there. A couple of projects. One in particular has been a collaboration with the Center for Global Women's Health Technologies that's focused on cervical cancer screening and treatment in Peru. And actually, I see one of my BAS students is here today. Hi, Margaret. So through that, we've been doing a policy analysis and costing analysis to implement a new screening device plus community health worker model to be able to improve screening and treatment of cervical cancer, which is one of the leading causes of death in low and middle income countries for women. Another project I wanted to highlight, also another partnership with the Duke, with the Department of Family Medicine and Community Health. Through BAS, we actually were able to launch a new course this summer that's focused on providing community-based mobile testing for the Latinx population in Durham. So this also ties into work that I've been leading along with Jillian and others that are on the call on anti-racism and health equity. So what we've been doing over the last couple of months is doing a rapid review of the work at Margelis and seeing how we can improve upon current work and make health equity more embedded in, in center projects across the board. And so happy to discuss that later as well. But again, this is, I guess, through my career, I've been able to merge a lot of my interdisciplinary interests and really, take opportunities as they came and grow from there. So thank you.
Great. And so I think next we're going to have Dave jump in.
Good afternoon. My name is Dave Anderson, and Andrea, that is an amazingly impressive path that you've taken. I want to highlight one theme from my experience, and it is an openness to go down paths that you never would have conceived of. I graduated from Carnegie Mellon in 2003 with a master's in public policy. I think I do a lot of economic development work. I have never been paid for in my entire career, which is a little bit of a change. That was another recession that we all graduated into, which is a common experience for y'all. So I started doing program evaluation for a series of social service nonprofits for the decade in the Pittsburgh area. Loved it. It was fascinating, it was interesting, and I'm not a good accountant, so it was not a good fit for me long term. Because fundamentally, federal program evaluation is a lot of counting and just showing that everything balances out. 2011, I started working at a health insurer in Pittsburgh, UPMC, and I was building provider networks and then working on risk adjustment in their Medicaid program later on. I actually found it fascinating. Never would have thought I would have found network development interesting, but the challenge of going, okay, if we include these sets of docs, how do patients respond? How does that interact with our marketing campaign? How does that interact with our pricing? It was a fascinating challenge to me. I never would have expected it. I thought when I took that job, it was going to be a 2-year job because I needed to pay. No. Concurrent, so I started working on the ACA build out for the UPMC health plan in 2012 and 2013. And at the same time, a blog I was reading, Balloon Juice, people going, the ACA is coming. What does that mean to me? Which is a really good question because health insurance is complex, it's confusing, it's weird. I knew some of the people who wrote at Balloon Juice in real life, and I said, hey, this is what I do for a living. Now I'll write 20, 30,000 words and explain what's going on in the fourth quarter of 2013, and I'll be done. I will have done a good deed, I'll be done with that. It was a minor mistake. I'm up to about just under 2 million words there over about 7 years and 2,000 pieces. And I found it absolutely fascinating. I was writing under a pen name because I wanted the privilege to call my boss's boss an idiot. No, you don't do that under your own name. Otherwise, you have very short, awkward conversations with HR. So I started writing under a pen name, and I was just trying to pull out, how does the ACA, the Affordable Care Act, work? What's actually happening here? How do insurers think through these problems? How do networks interact? How does risk adjustment interact with your experience as a consumer? Certain things get offered in these regions, but not those regions. And somehow I got brought into a bunch of conversations that I found absolutely fascinating and had national scale. Going forward, I was sort of kind of on the job market in 2016 just because I was looking for something a little bit different. Don Taylor, who is a core faculty member at Margelis, professor at Stanford and runs SSRI, Social Sciences Research Institute on campus, invited me down to talk, and the offer was amazing. Great people, doing amazing work, incredible weather, and the barbecue is not bad. Why not come down to Duke for that offer? So since I've come down to Duke in January 17, so 4 years, coming up on 4 years now, it's been an amazing growth and horizon opening experience for me. My primary focus has been on care delivery and payment reform efforts. Lots of different channels, currently working on Medicaid payment reform and care delivery efforts. Our big effort is, as we move over to Medicaid transformation with managed care, what does that look like for kids? What types of considerations does Duke need to make as a health system? What types of considerations would North Carolina state government need to consider? We've worked on palliative care and payment reform for that. At the end, looked at serious illness. I've also have done a lot of continual work within the Affordable Care Act universe. Currently working on a paper this morning to add edits in before we submit it as a working paper on what happens when people are exposed to plans that cost them nothing from $1. Does that change enrollment? Does that change how long people stay in a plan? Does that actually matter? So it's been an absolutely fascinating journey over the past 4 years. 10 years ago, if you asked me what I was going to be doing in 2020, I would not have even been consider health policy as a career. It just wasn't part of my universe. And I definitely would not have thought I was going to be at a research institution, a research university. So career-wise, keep your mind open. Weird stuff happens in very good ways.
Great, thank you. And next we're going to have Dev Sangbai give a few words as well. So Dev.
Great. Good afternoon, everyone, and thank you for this wonderful opportunity. Let me start by saying that I think for those of you who are students, you know that Duke offers a number of opportunities for professional development. And 10 months ago, I would have said the Margelis Center is a bit of a hidden gem among all the great things that Duke offers. But if you've paid any attention to what's happening with COVID, everything from how to effectively deploy PPE, to what we're going to do around economic recovery, to what does it really mean to generate a vaccine and vaccinate 8 billion people. The Margelis Center has really been in the forefront. So it's less of a hidden gem now and more really in the forefront of a lot of what's happening. And so you're really fortunate to have this incredible institution and this incredible resource available to you as you think about your academic and professional development. The other thing I'll add about the Margelis Center is that every one of the faculty members and those who participate really want to grow the next generation. So if you're interested in things, you'd be surprised at the connections you make and the ability to have those generate into ideas that you never thought of before. And in many cases, today's seminar is part of that. So I'm excited to participate in the Margelis Center. I've been a part of the faculty largely since we got started back in 2016. I've been at Duke for about 20 years. I entered in a traditional family medicine job, and it's what I trained in. I started here after doing my MBA and did all my medical school and residency training in Ohio. One of the things that I quickly learned, and I think you've all learned, probably already know because you're on the call, is that health policy is increasingly becoming a big part of what we do in healthcare. And the ability to really understand the implications of policy and how that may impact even the day-to-day delivery of care between one patient and one doctor is pretty impressive. It doesn't take long to think about how when you take a step back and look from a higher perspective, whether you're doing things like what David talked about with insurance, or really even thinking about disparities and those sorts of things like Andrea talked about with some of the work that she's done, health policy is going to be a part of whatever you do in medicine, whether you are actually providing clinical care or one of the thought leaders out there. So I've been excited to be a part of what we're doing here. I think that when I look at what we do today on the Duke Medicine side, or the Duke Health side rather, my work largely focuses on what we call population health management. So we have about 300,000 individuals throughout North Carolina and maybe even South Carolina and Virginia who consider Duke to be their medical home. And given the kind of relationships we have with their insurance company, we're obligated to provide the highest value care for those individuals. So it's not only ensuring people get the kind of care that they need in terms of screening tests for cancer or routine testing for chronic disease, but making sure we give it at the right care. We're giving that right care at the right time in the right place. So we spend a lot of time on trying to figure out how to generate value out of what we do. So I have the luxury in some way, or maybe the privilege rather, of being able to sit on the health system side and help us think about how we do those sorts of things, and then kind of think through the context of how you actually build policy. And one of the things I routinely say is that we need to think about how policy can help drive change, but at the same time, how we can influence policy through this change that we're seeing all around us. One of the real benefits of all of that is having early in career individuals participate in those processes. So I'm excited when we have undergraduates, graduate students, students from a professional school and others really want to participate in this process. I actually teach an undergraduate class. I think I may see one or two of my former students here focus on the idea of leadership and the changing landscape of healthcare. And through that, we talk about many of the things that are happening with the real goal of empowering individuals, early in career individuals, with the tools and in some cases just the excitement to want to change what is largely a broken system. So I'm excited to participate in today's panel. Look forward to the kind of questions we have, but I'm humbled to be in the presence of such great company. Thanks, Jillian.
Great. And so last we have Mira Gill. So I'm going to turn it over to Mira.
Thanks, Jillian. Hello, everyone. My name is Mira Gill. And before I start, I have to say that I'm truly honored to be on the same panel as Andrea, Dave, and Dev. As you've already heard, they're doing incredible work, and I feel very fortunate to have gotten the chance to hear about their work, both at Margelis and before they joined the center. So I'm still pretty early in my career path, so I don't know if I'll be as exciting to listen to, but I do hope that at the very least I can highlight some of the reasons that Margelis has been a wonderful place to work and learn about policy. So as Jillian mentioned, I'm a research assistant at the Duke-Margolis Center, and I joined the center mid-February of this year, so I've been here for almost 8 months. I graduated with my bachelor's in 2019, and as an undergrad, I was pre-med and I majored in Spanish with a secondary field of global health, which allowed me to maintain like a balance between the sciences and the humanities, which has always been really important to me because I think it helps me to look at issues from different sides and different perspectives. So in my junior and senior years of college, I studied the causes of maternal mortality and infant mortality in Hispanic and Latinx communities. And I became really passionate about such topics like related to public health, which made me develop a really strong interest in health policy. So I wanted to gain a better understanding of the ways policies are developed and how they can positively impact healthcare. And I wanted to see a different perspective on how medicine and people intersect. So I was very fortunate enough to join the Duke-Margolis community, where I'm on the biomedical innovation team. I work on topics primarily related to regulatory science and real-world evidence, and our team works with many different stakeholders, and we do a lot of our work in partnership with the FDA. So a large part of my work at the center is supporting research and writing for projects, as well as helping to convene big public meetings where we bring together and collaborate with many different policy and healthcare experts. And as you can imagine, it's been an especially interesting and busy time to work in health policy given the COVID-19 pandemic. So I've been able to work on a lot of projects related to COVID, such as exploring the use of real-world data sources to answer questions related to different therapeutics. And I'm also supporting the team with Dave, actually, some of our work on COVID testing strategies. So as a research assistant, I've had the opportunity to deepen my interest in health policy by continuing to pursue the topics I was initially interested in, and also learning about a lot of other key issues that affect healthcare today. But in addition to being able to work on a variety of different projects, I think the best part about working at Duke-Margolis is the people. I've gotten to learn a lot about the ways in which policymakers, healthcare providers, and the public intersect, and being able to learn from and work alongside policy experts and people who shared the desire to improve healthcare, like the panelists who presented before me and the rest of the Duke-Margolis team, has been a truly rewarding experience for me. And one that I know will have a lasting impact as I continue down my career path, and one that I hope will encourage those of you who are interested in health policy as well. So thank you all so much for your time today, and a special thank you to the education team at Margelis for hosting this event. And so I'll turn it back over to you, Jillian, for the Q&A.
Great, thank you. And so Sarah, I didn't know if the plan now, I know there's stuff you want to do in terms of how people can get engaged, but are first having some questions open to the panelists?
Yeah, absolutely. So you want to open it up for the next 15, 20 minutes or so to answer your questions that you have for the panelists or just for us in general. And then we'll talk through some ways that you can get engaged with the center. So to do that, you can either unmute, you can drop a question in the chat, or use the raise your hand feature.
I see Kathy.
I'm doing the low-tech raise your hand feature where you actually raise your hand as you try and figure out where that raise your hand feature is on this particular platform. It's nice to be with you all. I wanted to get a sense of how you collaborate with each other, just maybe an example or two of scholarly collaboration with each other, and potentially also an example of a way that you've collaborated with a practice community, specifically in North Carolina, if you have an example for that.
Okay, I think that's a wonderful question. Mira and I were working on a Rockefeller-funded project at the moment where we are part of a team that is attempting to develop protocols for COVID-19 testing optimization for high-risk populations. Now, so we use a full suite of regular tools of Slack, way too many Zooms, way too many emails. We do a lot of writing in Box. So even though we're distant, we're in routine daily contact with most of the team on a regular basis. As far as ideation and generation of ideas, now this is a little bit different, but I think my experience has been, there's a lot of coffee being drunk, lots of walks and talks happening in pre-COVID time, so I'm looking forward to those resuming.
And Kathy, we do a lot of collaborations, even just within Duke across different centers. So for example, I work very closely with a number of centers at the Duke Global Health Institute, including the Center for Policy Impact and Global Health, the Global Women's Health Technology Center, Global Health Innovations in Healthcare. I'm just going to continue. So a lot of collaborations. And what we've done, for example, is that sometimes we'll work specifically with a faculty member or with their team. And so it's a combination of, depending on the project and the project needs. And pretty much, I think all the panelists will be able to say this of, there is a lot of collaboration across different centers, but it is dependent on, opportunities that arise and what the specific needs are.
Yeah, I would say that, the collaboration probably exists at two levels. There's that broader collaboration, which can be institute to institute, school to school. And so we have that on a number of levels. And so Margelis Center and the health system on the delivery side have worked collaboratively on a number of efforts around Medicaid reform and a few other things that are high priority here in North Carolina. But even on a more granular level, you hate to make everything about COVID, but a great example has been a number of grants and other opportunities that members of Margelis Center have thought about submitting. And they really require kind of the real world evidence we get out of the healthcare system. So for example, if trying to understand the impact of telehealth, and because you want to study that more, we've got great data and great insight on the health system side. So we've collaborated on how to bridge know-how even in this rapidly evolving state. So it really happens at a lot of levels. And I'll tell you, at least one or two students who I work with closely have just quite frankly reached out, and we've been able to develop projects that we've never thought. So that collaboration is clearly on the ground and even as high as at the 100,000 feet level.
And do you think that it's fair to say that the collaboration with healthcare might be easier than with sort of local or state public health? Or are you, and I'm asking all very North Carolina specific questions because that's my interest as well. But I'm just curious about the relationship to potentially local and state public health as well.
I think it goes two ways. Yeah, I mean, if you think about the delivery side has its points of connectivity, which are in many ways actually focused on how you provide services, how you get reimbursed for your services. So there's a group of people you interact with on that side. But in some ways, I might even suggest that what the Margelis Center does and interacting with policymakers, not your government relations people, not your lobbyists, but actually the policymakers and how you help deliver policy or create policy is probably just as strong, if not stronger. The real magic occurs when those all intersect. So you asked about collaboration earlier. That's exactly how we're able to kind of think about if we want to make a change in North Carolina Medicaid, because our thought leaders really feel it's important. When you bridge the expertise of the Margelis Center and the real world evidence that comes out of Duke Health, it's hard to argue against that. Now, they don't always listen to us because they're policymakers and politicians, but we can really make a compelling case.
Yeah, and this is Jillian. I was just going to jump in there. I mean, because we actually have a very strong relationship, with the state and with the different local leaders here, and actually have several of our faculty members that have been kind of put into the state for different purposes. Previously, a couple of years ago, Erin McKeithen spent some time helping the state with their data strategy. Charlene Wong right now is working with the state on kind of a 6-month basis to help with contact tracing. We have other things like that. So I think that there is actually a really great relationship between, Duke broadly, as well as with the Margelis Center and with the state and with some of the decision makers, and trying to figure out how can we actually inform decisions on the, the timeline that they're needing right now.
Okay, great. Who else has a question?
There's a question from Audrey.
Oh, go ahead, Audrey.
Yeah, hi. I'm Audrey Dotson. I'm a first-year daytime MBA student at Fuqua, and I spent the last 5 years in public sector healthcare consulting. I'm just interested to know if there are any perspectives or research you're developing on the impacts of COVID-19 in the future health system. And I know that's a really broad question. It can go a lot of directions, but in particular, like what changes do you think will be temporary and what will be more long-lasting?
Yeah, so so there's a ton going on within the center related to this. And actually, so Rob Saunders leads our healthcare transformation team. And one of the things that they're looking at a lot of is kind of exactly what you're saying. What are some of the changes that are happening right now that will, go back to, supposed normal afterwards? And what are some other things that are going to be, persistent changes? I mean, one of the obvious things that started immediately was the use of telehealth and how we're incorporating that into practice and policy. And Deb could probably speak to this as well. But there's just a huge range of how we're practicing medicine and how we're paying for things and the different regulations. And I think that there's, you know, some really good things that are actually going to come out in the terms of the changes of from the pandemic. But Deb, I don't know if you want to jump on any of that.
Yeah, I mean, I think Jillian, you hit the nail right on the head there. There's so much out there. In fact, I think what we know is that early in the pandemic, I think there were a number of people who thought that they could predict what October and November might look like. And as you know, most of them are probably wrong. So people are a little bit cautious about making predictions, but there are a number of infrastructure changes that'll be hard to step back from. You know, telehealth is a great example because I think at one point we would have probably said, you don't need bricks and mortar anymore. Everything's going to be telehealth. The evidence now suggests that that might not be the case. At least the practical anecdotal evidence suggests that you're still going to need some significant investment in bricks and mortar. And as I even think about what interactions I may have with pharma, it's the same thing. It's no longer about how you actually you know, increase sales of a particular medication and so forth, but really think about how you impact total cost of care. Those were conversations that predate COVID, but I've seen them accelerate more. And then the other piece that, of course, is that we're trying to figure out how to do everything is the question of equity and trying to make sure that we've balanced everything out in a way that makes sense. So a lot that's happening. What I can say is there's insufficient bandwidth to think through all the things that are happening. So the more people that are interested in this and actually creating some level of critical mass at Duke, I think the better we're going to be prepared for whatever post-COVID looks like.
And let me just add on to that. Two of the questions that I have found fascinating is the movement towards, and probably the acceleration towards, alternative payment methodologies where you have population health payments instead of fee-for-service. What we saw in the spring is practice organizations that are fundamentally on a fee-for-service widget basis. No, do something, get paid, do something, get paid, were crushed. Entities that were on an APM capitation basis were in pretty good shape, and they were able to adapt quickly on the fly. There's a mass interest within the state of North Carolina to push towards, you know, capitated population health payment systems, you know, through all payment streams. So that's something that's going to be belonging. The other question that I have on a personal research level of interest is how do people respond to this massive health shock, and how do they respond to their desire for insurance and coverage? And that's something that we're going to be trying to find out over the next couple of years.
Thank you. Stephen Colville had a question.
Yes, thank you very much. So my question is, I'm curious about how the center's interaction with faculty typically works. Like, are the faculty at Duke part of the ingrained within the teams and the work streams that you're pushing forward, or are you as a research team at Margelis Center, are you typically reaching out to a particular faculty member who might have some applicable areas of expertise to a project that you're working on?
Yeah, so this is Jillian. And so there's a range of different ways that the faculty are engaged, and also a range of different levels. So as I mentioned, we have about 50 core faculty, and then we have, I think, 13 affiliated faculty. The core faculty are definitely very ingrained into the center. You know, some of them have research projects where they're the principal investigator, and then some of the staff and students are kind of working on those projects. Other ones are projects that are being driven by one of our research staff members, and faculty might be involved as a co-investigator or as an advisor. And so that varies. But, you know, the faculty within the group, they also, you know, so Sarah will talk about in a moment, we have a summer internship program. And so a lot of the faculty mentor students during that, or mentor them as research students throughout the year. And then we support faculty in different ways. And so, you know, some of them we support part of their effort for kind of research projects or for teaching. Other ones we support by kind of connecting them with research staff and policy experts. A lot of the things that we also do is work with faculty members who might not have been have their research kind of integrated into policy, and we work to kind of take their research and help that make that translation. And so it varies, and a lot of those faculty then over time kind of you know, ramp up how much they're working with the center. But there's a wide range and a lot of different ways that we interact. And then actually in terms of physically, I think one of the questions, so we have a few faculty that, when we are physically in an office space at Duke, that are housed within our space, but then the other faculty are kind of spread across the university and then come together for, seminars and meetings and things like that.
And Jillian, I just wanted to
Sarah,
as well, because I think it's great to be at Margelis, because even if you're not working directly with a faculty member, there are always opportunities to reach out, and like there are always people who know other people who are like, oh, you're really interested in that, well, why don't you talk to this person? So it's a great way to be able to get to know a lot of people. And even though we've had to go virtual, it's actually been it's been good in some ways, because I've gotten to meet a lot more people across the center, because I'm at the DC office with Andrea, but I'm working on a project with Dave, who I hadn't gotten to work with before. So there are, I think, a lot of opportunities for being able to engage with faculty as well.
Great, thank you.
Natalie.
Hi, I'm an undergraduate student here at Trinity, and I was just kind of wondering, obviously there's a lot of really interesting research happening in the health policy world right now. So I was just wondering what you guys think is the best way for undergraduate students to get involved in some of these really cool projects that are happening.
Sarah, that's for you.
Yeah, it is. Okay, I want to maybe actually, can I pause your question in case there's one other question, and then we'll move on to that, because we're going to spend a few minutes and I'm going to show a couple of slides. So is there does anybody else have a question? I think Kathy had a question about qualitative methodologies, and then we'll answer Natalie's question.
Sarah, I've had a chance to speak, so why don't we go ahead with how are you going to answer Natalie's? That's fine with me.
Great.
Thanks.
All right, let me just a second.
Actually, so one thing just before you dive in, so we do a lot of both quantitative and qualitative, kind of mixed methods, and I think that there's a lot of our faculty also have their primary appointments within population health sciences that has a large area of expertise related to the qualitative methods. But so I think as there's opportunities for that as well. But Sarah, back to you.
Yeah, great, thank you. So just so everybody knows, there are both Duke students and non-Duke students on the open house today, as well as others who may be prospective students. So I'm going to speak to both ways that Duke students can directly get involved, as well as those who are not necessarily Duke students just yet, or somehow engaged with Duke. Okay, so first thing that we're going to start with, and can everybody see my screen? Can I just get a thumbs up? Okay, perfect. So first thing I'm going to talk about is the Margelis Seminars and health policy. So these seminars that we have, they're roughly about every 2 weeks, and they aim to connect the Duke-wide health policy community and help people form and shape and develop their health policy related work. So most of these seminars cover research or policy analysis that are in progress, while other presentations by faculty, staff, and visitors they talk about significantly newly released research or legislation or regulations that are happening. So at this time, these are restricted to those within the Duke community. And however, if you're not affiliated with the Duke community yet, that doesn't mean that you can't join us for some of our events. So we have lots of public workshops and webinars that that people can attend that include some of these topics that are talked about in a more private Duke community only event. And those can be found under events on our website. And those happen every other Friday afternoon. Okay, so then we have our Margelis Scholars program. And this is, it's a prestigious program for Duke University students that demonstrate a strong interest and commitment to a career in health policy and management, as well as leadership potential to improve health policy. So the Margelis Scholar programs provides these promising students with the necessary skills, knowledge, and abilities to be the next generation of health policy leaders. And some activities that these scholars will participate in are a health policy boot camp. We have journal clubs, we have scholars skills labs and social events, but they also receive direct mentorship and coursework. And so in terms of eligibility, there's there are two different types of eligibility. So undergraduate students can apply starting in their sophomore year, or as they're getting ready to start their sophomore year, and because it's a 2-year program. And then then graduate students apply, but like after they accept to Duke. So if you're a prospective student who's thinking about accepting to Duke, you can apply later in April and join and be a part of the scholars community over the 2-year time period that you're at Duke for your graduate program. We do have a special accelerated program for those who are in the med school. So it's a 1-year scholars program, and you apply at the before you start your 3rd year, which is typically a research year for Duke medical students. Okay. Another program that we have, and this is open to Duke and non-Duke students and fresh graduates. So if you're within a few months of graduating, the summer intern or our internship program is also available to you. And so the internship program, it's a 10-week paid internship experience in either Washington, D.C. or Durham, and that's when we're in person. This year in particular, we're going to be virtual again. And so unless something miraculously happens between now and the end of spring, but it's open to undergraduates and graduate students. And so the aim here is that students will gain experience in quantitative and qualitative research methods. They'll receive training and coaching on research and the research skills, presentation and writing skills, but also broader topics that are facing health policy right now. So we have kind of 4 core areas which the center operates. So we have healthcare transformation, biomedical innovation, global health, and education and workforce development. And so we offer internships in all 4 of our aspects in our core focal areas. And the program is also designed to help students and early career professionals to start to develop a professional network and peer network with other people who are interested in health policy. So in terms of the student experience, the way that our program is functioned is that you are directly matched with a mentor / research team, and you'll work on a specific project over the course of 10 weeks. And so as a culminating experience, we have kind of 3 key things that we ask people to complete, which is we have a research symposium that we put on. When we're in person, we do it with all the programs across Duke who are doing summer research. So that way you can get to know other scholars in this space, and they're all typically in the STEM fields and health related fields. And then if we're virtual, then things are done virtually. So we'll have a virtual poster presentation. There's also an oral research presentation that was done at the seminar. And then we ask students to do like a reflection blog. So we have some other events that kind of help connect students, whether they're virtual or not, which is the seminar and the symposium. We have this past year, we launched an anti-racism discussion group, as well as a journal club. And then you have some opportunities to like build community within the intern group through like socials and lunches. And when we are capable of travel, we do a trip, a health policy networking and experiential learning opportunity in Washington, D.C. So those who would be based in Durham, if they're in person, they also get to go to D.C. and experience what our office and life is like there. So we start recruiting for that early. So for us, the application opens in December and it closes in January. And we notify students, apologies, my key dates did not pop for me. 1 second. And so the application starts in December and closes in January, and we notify like in early to mid-March. That way students, because we do that, it takes us a little bit longer just because we do these direct connections to mentors. We want to make sure that that mentor-mentee match is going to be the right fit. Okay, and then we have 2 other ways to engage with the center. And that is through Fast Connections. And you heard Andrea mention that she has a Fast Connections class, and it's basically these are projects that us as researchers and faculty and staff, we come together and we use these to try and bridge the gap between the classroom and the real world. So it's an opportunity to give students a chance to roll up their sleeve and tackle like complex societal problems on these interdisciplinary teams. So they work on these interdisciplinary teams of graduate and undergraduate students, faculty and staff on this cutting edge research that spans all sorts of topics, demographic groups, and borders. So we're fortunate enough to have several different types of projects within the Margelis Center. Currently we have, we're administering the Fast Connections COVID pop-up theme. And this is specifically focused on projects that are, trying to address issues related to the COVID-19 pandemic. And just to kind of give an example of some of the types of projects that we have in this particular area, it's looking at everything from elections in the time of the pandemic, all the way through looking at telehealth and the implementation of electronic symptom screenings related to COVID. Andrea's project is looking at food insecurity and resiliency to COVID-19 for the Latinx population. But we're also looking at things such as, the good that comes from bad dreams and what's happening now that people are dreaming more now that they're, not as simulated and things like that. So we have a wide variety of opportunities related to the specific COVID aspect of things. But in addition to that, we have several other projects that we're working on, including, and these are across different themes, but we have one on the help desk, which has been a very popular, and they've been putting out a lot of material lately on scaling volunteer models that address patient needs. We have one that I actually am the team lead on, which is increasing access to laparoscopic surgery in low and middle income countries. We have things on, the North Carolina Early Action Hood plan, and trying to create evidence-based policy solutions. And so for Duke students, you're able to apply to these to be a part of these teams. And so applications happen twice a year. And so the primary application is in January of this upcoming year. And so you kind of get to choose several, and you can apply to be in more than one project, and then you typically get interviewed by the theme leads and things like that. Okay, for those of you who are considering coming to Duke for the Master's in Population Health Sciences, we have partnered with them to offer a health policy concentration. And for over the course of the next couple of years, we're going to be working with other departments as well to build out health policy concentrations where it makes sense. And so this is a new opportunity that starts in the fall of this coming year. And it's really being able to understand, the current US healthcare system and understand the ecosystems that shapes policy decisions and so on and so forth. And then I lied. I misspoke. I have a couple more things and ways to get involved. So if you're a student here at Duke right now, we have the Student Collaborative on Health Policy, and they partner with us on hosting a lot of events related to health policy around campus. They also host their own. They do a lot of campus engagement, career and professional development, and they support us with the health policy education aspect and advocating for students, and to make sure that we're providing opportunities where we can. They have, and they work across disciplines as well. And so if you're interested in getting involved with them, I apologize, I skipped ahead. Here's the contact information for those folks. They are launching this year a health policy week, and that is starting next week, and this event kind of helps to kick that off. So they have several events that are available, you know, on campus, or I'm sorry, available online for those students who are interested. So I'm going to stop talking there, and hopefully, Natalie, that answered your question. And let's see, we do have maybe time enough for one more question around anything that I just said. And I'm sorry I spoke really fast, but I wanted to give you all the different ways that you could get involved as both Duke students, prospective students, or non-Duke students.
Sarah, can I add one thing about BASS?
Yes, please.
So I think what's really great about the BASS program too is, which Sarah already highlighted in terms of the interdisciplinary nature, but often it brings together programs that otherwise might not be working together. So like one of the projects that I'm working on is with biomedical engineering, documentary studies, and Margelis. That project otherwise probably would not have happened, at least it probably would not have started through a research project per se, like a traditional grant. So that's another opportunity too. And, you know, the students are, you know, across all the schools at Duke. So just wanted to highlight that. And then a second point too, for the internships as well, I think that that's a really great opportunity to forge relationships, both with the faculty that you're working with or other research team members that then can lead to opportunities, whether in one case, actually, this was rare, but actually my current senior research assistant interned with me over last summer. And so then she joined in October of last year. But there's many opportunities, you know, of building your network and engaging with team members for more opportunities moving forward.
Thanks, Andrea. And then I think we have some of us can hang back. So Audrey, if you have your question.
Yeah, I just have a quick clarifying question about the Margelis Scholars program. It seemed like from the slides that if you didn't apply before you started, that there wouldn't be another opportunity to apply, or is, I don't know, Kate, seems like you're about to.
For graduates, yes.
For FUCA students.
For graduate students, that is the case.
Okay.
Jillian?
Yeah, I was just gonna say, I mean, I can't remember what kind of graduate student, because
Audrey's a FUCA student.
Oh, okay, for FUCA student. Yeah, well, so I think that probably is the case, but we could certainly be thinking about other ways to, I mean, it's because it's changing. Let's talk with Audrey about specifically different things. So yeah,
okay.
But
thanks.
Okay. Well, I want to thank our panelists and for taking their time today to share their stories and to share some of the work that they've been doing here at the Duke-Margolis Center. I want to thank all of you for taking the time to join us and for your active participation and engagement. I know we all get screen fatigue, so we really appreciate you spending your lunch hour and getting to know the Duke-Margolis Center a little bit better. We are going to be making this recording available on our Student Voices YouTube page. That way, other students who are interested in learning who weren't able to attend will have access to the presentation. We'll send a link to all of you so you can share it to people who you think may be interested in as well. So thank you all for your time. I hope you have a great afternoon.
Thank you.
Bye.
Thank you so much.
You're welcome. Thanks. Kate, I'm staying on for you. Hold on one sec.
Thank you.
You're welcome. Okay, Kamaria works with us, so she can let me stop recording.